Tell me more about the new interventions and like new technologies that are coming in this industry.
So lots and lots of new things are coming. For example, like AI is coming, and AI is very helpful in radiology.
AI is helpful here as well?
Very,
Okay,
very,
great.
very helpful. So as I mentioned about the trauma scan, we use AI as an adjunct, and I think that will be the case for a good few years, because AI is very helpful in even looking at the pictures and interpreting them, and it's getting better day by day.
Okay.
So what?
Sorry, I'm interrupting. So how does it help really?
So for example, it like trauma scan has, for example, 5,000 images.
Okay.
Yeah. So radiologists can interpret this because we are all trained to interpret those.
Yeah.
But at the same time, in parallel, we can run that scan through the AI algorithm as well.
Okay.
So it can highlight if just by mistake, if we have overlooked something, if we have overlooked something.
Yeah, okay.
So we do not use AI as the first tool. In my practice, I look at the scan myself. I look at the scan, make my report, and then in the end, I run the algorithm.
It's like a cross-check.
Cross-check. So it's useful because, as I said, always we do not want anything for the patient to be missed.
Yeah.
And it's always a very good tool to help us. So that's one thing. Second thing, like CT scan and MRI, they are coming with very, very advanced techniques because in MRI, what happens is it takes a little bit of time, like 20 minutes or 30 minutes to do a scan.
Yeah.
And MRI, normal patient understanding is that it's a tunnel, and some patients get claustrophobic of tight, closed spaces. So these days the techniques are changing. One thing is called deep resolve, which is a like AI based algorithm. Okay. And in that case, what they can do is they can actually shorten the scan acquisition time by 73%.
Oh.
So for example, a scan which could be done in 20 minutes can be done these days in 7-8 minutes. So it's an amazing thing which has already happening in the market, and these algorithms are like revolutionizing the treatment and the diagnosis and the patient experience as well, because they do not have to lie in the scanner that much.
Yeah.
Sometimes we have to do 4 or 5 body part of the patient, both shoulder, both hip, both knee. In that case, towards the end, patient gets tired and they get they start moving, and then the image quality is poor.
Yeah.
So if this type of algorithm is there, that helps them. Then there are new things coming like wipe sequences in spine, which is like in the past, if we would use to see a fracture, which is better visualized on CT rather than MRI, because on MRI, you see like the edema mean like a slight watery signal. Yeah. So that means it could be a fracture or bone bruising, for example. Yeah. So that is better seen on MRI, but the crispness of the fracture is better seen on CT scan, the definition.
So in that case, would you do both?
Yes. So that is the where I was coming to. So in the past, the common practice was to do both.
Okay.
And this is a common problem with young gymnasts, which is 15-year-old, 16-year-old.
Yeah.
And I was telling you in the beginning that we do not want to do the radiation, although a tiny bit. Dose.
Yeah.
It used to be very limited dose CT scan we used to do in the past, but now it has all been replaced by this technique called wipe sequence. Okay. In wipe sequence in MRI, we are capable of almost acquiring similar type of images we can get with the CT scan. So this is the technique.
But then without radiology.
Without radiation. Because MRI is not with radiation.
Okay.
So we do not need to irradiate a young child or adolescent. Yeah. There are multiple other things which are coming, like molecular techniques are coming. There is image guided stem cell technique. You might have heard of stem cells, yes. Stem cell injections. These are coming. There are a lot of regenerative techniques are coming, like platelet rich plasma we do under ultrasound guidance. It's becoming very trendy because a lot of patients, there is a trend like nobody wants any extra chemical inside their body.
True.
And people are more like if we can have without chemicals. So they nobody likes like taking extra drugs.
Yeah.
So platelet rich plasma is when we extract the patient's own blood we spin it like for 15 minutes.
Yeah.
And then we get this 5 ml of platelet rich plasma, which has got multiple healing substances that can be injected back into the affected place.
Okay.
So these all techniques which have become popular in the recent years, they are extremely good for patient and young patients usually prefer these things. Sporty patients, they prefer these techniques.
Okay.
There is something called diffusion imaging is coming. There's like molecular mapping we can do chondral mapping by MRI scan. So lots and lots of new things are coming. Functional imaging is coming, which can look at the tissue level, that how molecules are working in the body. So these are advanced technique, and they are getting better and better every day, and they are being used by a lot of us. So this is something that's why we have to keep ourselves up to date and learn those techniques as well and use them in our day-to-day practice.
I was coming to that. So how do you stay up to date, like with lectures and conferences and teaching yourself whatever is coming out in the market, whatever new things are happening, new developments?
Yes. So radiology is evolving very, very fast.
Yeah.
And so we do attend regular conferences. Like I get invited to go and present papers in conferences throughout the world. So I've already got 40, 50 international PubMed index papers.
Wow,
I even
great.
published 2 initial papers at the COVID time with new information.
Yeah.
So I get invited to multiple conferences, and I attend and I do examine the students for FRCR.
Yeah.
So when we go and meet each other, we share our knowledge. We talk to each other, listen to speakers throughout the world, and they always talk about different interesting topics. And as a doctor, I would say one thing which attracts me the more, where people accepts their challenges and the something where it has gone wrong, and they're sharing that type of experiences, because that is our learning process and learning pathway where we all learn from it, right? Rather, if somebody says that I've done this and I've been wonderful, I would rather go and listen to a talk where somebody is humbly accepting something which has gone wrong and what they have learned from it. And I like to present those type of talks myself. Although we all try our best, but it's sometimes a very small proportion, very, very small proportion, you will learn something by that particular tiny mistake.
Yeah.
And there is a very good culture in UK that we document them, we mention to the patient, we involve them, and that's the learning pathway. And that's where we change our practice as well. So all these conferences make us learn new things and from each other's experiences, how the things can be done better. For example, in my consultant job since last 11 years, I have moved from different modalities to different modalities. I will give you one example that the type of needle we use, that can make the patient whole journey very, very different. Like I found a very special, tiniest needle in one of the hospitals, and I advise all the other hospitals to bring that needle.
Bring the same,
So it just patient don't even feel that one. So that looks like that is small, very tiny thing, but it can change the patient overall experience in the journey. Because they're very worried when they're coming to us. True. And they're very anxious, and you do not want them to have a very bad experience or bad experience.
True.
So anything which can be reduced, all that type of things can be very useful.